Welcome to the Lynn Cancer Institute updates. We're trying to keep you in the know in 2024. We're very grateful to have you all with us today to learn from our very own clinical dietitian, Katie Lauterbach. Katie will be educating us on the nutritional guidelines for blood cancer treatment. At the Lynn Cancer Institute, we believe that nutrition is the basis of healthy living, not only for our patients and survivors, but for all of us. So, Katie, we thank you for educating us today. During her presentation, we encourage you to take notes. And if you have any questions, please put them in the chat box or the Q&A box because she will not be able to hear you or see you during the presentation. So that being said, we're very proud to welcome you to the Lynn Cancer Institute and to introduce Katie Lauterbach, our Lynn Cancer Institute clinical dietitian. Thank you, Katie.
Thank you, Jan, for the introduction. I really appreciate that. Always good at introducing us. So today we're going to be talking about nutritional guidelines for blood cancer treatment. Really hoping that that this is useful to more than just people who are being treated for blood cancer. This can actually be a topic that applies to a lot of different people with the content that we're discussing. So hopefully we find it useful. And the reason why we're focusing on blood cancer this month is because it's Blood Cancer Awareness Month. And that's held every September, really to raise the profile of blood cancer, which really doesn't get the attention of a lot of other cancers. So, this is me highlighting it. And it is a common cancer. Approximately every 3 minutes, one person in the US is diagnosed with either leukemia, lymphoma, or myeloma. So it's worth talking about. So this amounts to being approximately 10% of the cancers diagnosed in the US, and those are of the leukemia, the lymphoma, and the multiple myeloma categories, and those are all blood cancers. So this group of cancers is also sometimes you'll hear referred to as the hematologic malignancies. That just means that it's a cancer that's affecting the blood, the lymph, the blood cells. And these cancers can disrupt that normal process of blood cell development, which in turn can prevent healthy cells from carrying out their regular functions, such as fighting infections, forming blood clots, carrying oxygen to other cells. So that's what the blood cancer refers to, and that's what I'm referring to during this talk. So we'll go over the food safety components when being immune compromised, which is a really important part of not only blood cancer, but all other cancers as well. We also want to focus on nutrients like vitamin D for bone health. That's a particular nutrient of importance for blood cancer. And then we also want to focus on anemia and low platelet nutrition, because these can be common things that happen in our blood cancer patients as well. So starting off with the food safety component, during cancer treatment, food safety is actually very critical because cancer and its treatment is going to weaken the body's immune system by affecting blood cells that protect us from fighting these germs and fighting these diseases that we can come across every single day. And as a result, the body cannot fight those infections and that bacteria as well as someone who has a healthy immune system can. And so this really increases that risk of foodborne illness. So to minimize this risk is really essential that we're following these food safety measures. So the top 3, if I have to categorize it, are going to be food handling, avoiding the cross-contamination, and cooking our food really well. These 3 things are going to help significantly reduce any risk of foodborne illness. So with food handling, it sounds so obvious, but of course, it's something that is essential and something that is going to drastically reduce your risks of foodborne illness. It's washing your hands. So washing your hands for 20 seconds before handling any food, eating any food is going to be really important. It's important to also make sure that we handle food properly. So we don't want to be mixing any raw meats or raw meats with vegetables, because that's going to be something that's cross-contamination. We also want to make sure that in the fridge that they're stored properly in a closed container that's not going to be spilling on any fresh fruits or vegetables. We also don't want to be thawing these foods at room temperature. So if we thaw something like a frozen chicken breast at room temperature, that is putting it in a situation to have the bacteria double because of the temperature of the room. So we really want to thaw these raw meat or these frozen meats at in the fridge to help keep it at the correct temperature. It does take longer, but it's safer. And we want to wash produce prior to cutting it, and then also after cutting it to make sure that we're preventing any um, bacteria spreading. So it's good to wash the produce under cold running water. We don't want to wash it in hot water because that will actually make the bacteria grow. And we also we don't need to use any detergents or vinegars or soaps. We can just use plain water. That's the best way to wash, and have it be running water so that way the bacteria is constantly running off of the produce. Avoiding cross-contamination, use separate cutting boards, use separate knives, clean your surfaces constantly with hot soapy water, or you can use a bleach solution. So 1 part bleach, 10 parts water, and that's going to help reduce the spread of germs as well. They say too that there's more germs on your kitchen counter than even on your toilet. So just more motivation to get the bleach out, get some soapy water out, and wash everything down constantly, especially when handling raw meats. We want to cook food really well too. That's the other way that we can kill bacteria is by cooking food. So cook your meats. So cook your meats to at least 160 degrees, and then poultry to 180 degrees. These are the temperatures that are going to help kill the bacteria, and that's very, very important. We also, if you're heating up food, we want to be putting it in the microwave and constantly stirring it. So if you have some type of a turntable in the microwave, that's helpful. Otherwise, you need to constantly rotate it yourself manually. And then also stirring it is going to help avoid any cold spots in the food, the cold spots could grow more bacteria. So rotating the food is very important. Talking more about food temperature. So I briefly mentioned it when I mentioned about cooking food, but the food temperature is a very, very important aspect of the food safety. So this is helpful in preventing the bacteria from growing. So bacteria grows most rapidly at this temperature called the danger zone. So that danger zone is anywhere from 40 degrees to 140 degrees Fahrenheit. You think about it, when we refrigerate things, it's usually under 40 degrees. And when we cook things, we're typically cooking them above 140 degrees. So that's why if we're not refrigerating or heating it, it can be in what's called the danger zone. So we want to limit the amount of time food is spent in the danger zone because bacteria like Salmonella, E. coli, those can double every 20 minutes when the food is held at these temperatures between 40 and 140 degrees. So never leave food out in that danger zone for more than 2 hours. And if it's being held, especially between 90 and 140, it should not be out longer than an hour. So we just want to be really careful. Think about the gatherings like Thanksgiving, a birthday party, holidays, where we sometimes have hot food dishes out for very long periods of time. Really try to be mindful of either keeping it in something like a chafing dish, a warming tray, a slow cooker at a temperature that's appropriate, such as above 140 degrees, or be very mindful that it doesn't stay out for longer than 2 hours once it's served. We also want to make sure that anything that is supposed to be staying cold is below 40 degrees. So think about those things like the charcuterie boards, or if you're having out like a shrimp cocktail or something, we want to make sure that it's on ice, that it is being held cold at 40 degrees or below in order to prevent the bacteria from spreading. When it comes to cooking and reheating, that's another time that the food is very vulnerable to those temperatures. And so when you're reheating things, make sure that your food reaches 165 degrees Fahrenheit. That is considered the temperature needed to kill any bacteria from reheating food. And it should be steaming hot throughout. We don't want any cold spots in the food because, again, bacteria can grow there. So Leftovers also should be stored within 2 hours of being out, similar to how you want to leave out your food for no longer than 2 hours. And this is to prevent the bacteria from regrowing. Even if it's not considered a leftover, maybe you're food prepping for the week, and you're letting your rice cool before you put it in your, containers. Make sure it's not out longer than 2 hours before you put it away. You can always refrigerate it even though it's hot, before it cools off in order to just reach that temperature quicker, because we want to keep the food safe. So here are some common foodborne illnesses, which can be especially dangerous for people with weakened immune systems, such as people going through cancer treatment. And typically symptoms of these are going to be very similar to potential symptoms that you might even get through a cancer treatment or any other illness. So it's very hard to determine when something's a foodborne illness, especially since the onset of these things can be delayed. So what we would look for foodborne illness would be things that are very common. Like I said, fever, vomiting, nausea, stomach pain, cramps, diarrhea. Usually the really bad bowel movements, diarrhea, bloody diarrhea are going to be very notable things of a foodborne illness. Something that's a misconception is people think that you would get these side effects immediately after eating the food, and that's not always the case. Sometimes these things can present a few days after eating the food, 2, 3, 4 days after eating a food. And so it's very, very hard to determine if it's a foodborne illness. But regardless, if you're experiencing these symptoms, of course, contact your healthcare provider, and let them know of what you're experiencing, and they can also help you determine if it might have been a foodborne illness. But I do want to highlight a few foods on here, and honestly, most people should be avoiding these foods. It's not just people undergoing treatment or people at risk of foodborne illness. I personally also choose not to eat some of these things just because they are so high risk. So something that I don't want my patients to eat and that I would never eat are raw oysters. Raw oysters, every single year they're recalled. There's some case of oysters being bad that has a foodborne illness. So I just stay away from them unless you're going to have something like an oyster Rockefeller that's cooked. You don't want to do any raw or uncooked oysters. So those are actually something that it can be multiple different foodborne illnesses, but there's one particular in common that it causes the Vibrio. The raw sprouts, I also would never eat. They're very, very hard to clean, which is why there's such a high risk of contamination. So things like E. coli, it's very common to get E. coli in sprouts. And it's just very hard to clean the sprouts. So I don't recommend anyone going under treatment to have this. And if you do have a strong immune system, it's just a chance you're taking. Actually, at Jimmy John's, that sandwich place, they used to have sprouts on one of their sandwiches, and they removed them because they were just such a high risk for foodborne illness, and it kept coming up as an issue, and so they just took them off the sandwiches. Another one is raw milk. I sometimes see people jump on this trend of raw milk or unpasteurized milk because they say that it has more nutrients in it. While it's true that the pasteurization can destroy certain nutrients in the milk, a lot of them are refortified with those nutrients, and we do not want the milk to be contaminated with E. coli, because it's very dangerous. So raw milk is a huge source of E. coli, and there can be a lot of fecal matter in the milk if we don't pasteurize it. Raw milk is actually prohibited to sell in Florida, but trust me, people can still find it and drink it. So I recommend staying away from anything like that. The other thing is deli meat. Deli meat is a huge risk of foodborne illness, especially listeria. There is actually just a listeria outbreak for deli meat, for the boar's head, which is a bummer because boar's head is one of my favorite types of lunch meat, deli meat, because it doesn't have those nitrates in it, but it still is a high risk for foodborne illness. So things that you can do would be heating the lunch meat to steaming or just avoiding it. And follow those, even if you follow the sell-by dates, it still can be contaminated with that bacteria. So we want to avoid that. So as you can see, there's a lot of different things that can put us at risk for foodborne illness. But it's most important to follow these things when we're immune compromised, especially if you have low white blood cell counts. That's when we should be particularly aware, mindful of these things. And then as a rule of thumb, if you do have low white blood cell counts, I would avoid these particular foods. So the things like the raw or uncooked meat. So an example of this would be like, sushi, or it could be, tartars, or some people might order a steak rare, and those would be examples of an undercooked meat that we want to avoid. We want to avoid any unpasteurized milk or beverages, so make sure those juices are pasteurized too. We want to avoid any soft cheeses made from unpasteurized milk, so careful of like those bries that are unpasteurized, or a mozzarella that's unpasteurized. We want to avoid any raw or undercooked eggs. So if you go out to eat for breakfast, don't get in over easy. Make sure they're cooked well or scrambled. We want to avoid the deli meats or the cold hot dogs, because those, like we just said, they can have listeria. The raw sprouts, let's stay away from. And then make sure you wash all your fruits and vegetables well. Cold running water again, and you can even use a scrub brush to scrub off some of the harder, vegetables and fruits. So even if it's something like a cantaloupe, we want to really scrub the outside of that, because when we cut into the, even though we're not eating the rind, we're cutting into the rind, and then that can introduce the bacteria through the fruit. So washing everything really well. And then it's a rule of thumb to avoid salad bars and buffets, because these, again, just holding things at the right temperature can be really difficult to do, but then also the cross-contamination and people all putting their hands on things and scooping up food. During COVID, a lot of salad bars were closed and a lot of hot bars were closed because of the high risk of cross-contamination and risk of infection introduction. So those are just things I would avoid if you have low white blood cell counts. So you can actually, a good way to also look at food recalls and be on top of the food recalls is by looking at the FDA website. So you can actually monitor all the FDA recalls and safety alerts on their website. You can also sign up to receive their safety alerts. So if you'll notice on the top of this, you can see the part where it says sign up to receive the alerts. They're worth it if you are someone that needs to be very careful of avoiding these things. And it's shocking how many food recalls there constantly are all the time. We just don't hear about it unless it's like a huge outbreak that has resulted in several deaths usually. But as you can see, even just from a couple weeks ago, I took this screenshot last week, and you can see on there we have cantaloupe, we have eggs, as being things that are potentially contaminated with salmonella. So you'll see though that there are certain brand names and they're at particular stores. So that's the nice aspect of this website, is you can click into the brand name and you can see the actual stores that these foods have been distributed to. So that can also help you determine if the cantaloupe that you bought or the eggs that you bought are contaminated or not. You'll also see undeclared items on this page, which just means that they did not list them on the allergen label or on the list of ingredients as allergens. So this can also be good too. If anyone has really severe allergies, it might be nice to follow this page as well to make sure that none of those foods that you're eating can have those allergens that might not be listed on the label. So that's a good resource for people. The next part that I want to transition into is talking about the special nutrients of focus for blood cancer. So I'm going to be talking about the vitamin D and the other nutrients needed for anemias. So vitamin D is very important to get enough of during cancer treatment. It's not one of those nutrients that you have to be that can interact with treatment or that we have to be avoiding. Sometimes we'll tell people avoid really high dose antioxidant supplements, but we never want you to stop a vitamin D supplement because that's usually actually beneficial for you during treatment. And so particularly with the blood cancers, we see that they're at higher risk of osteoporosis, and up to 80% of patients with multiple myeloma will have some type of bone lesion at the time of diagnosis, and 60% 5% can actually develop pathologic fractures over the course of their disease. So really high percentage of these multiple myeloma patients having bone concerns. And it's estimated that 75% of patients with multiple myeloma actually have an osteopenia or osteoporosis. So again, high percentage of them. And this is partially because patients with the multiple myeloma have increased osteoclast and decreased osteoblast activity, which basically just puts the bone in a more vulnerable position to be broke down. And the risk of osteoporosis in patients with multiple myeloma is actually further increased with these chronic steroid regimens that they're having to use with their treatments. So other notable blood cancers that need to be aware of their vitamin D levels would be the AML and the diffuse large B-cell lymphomas. So when patients with AML had low levels of vitamin D, they were found to have worse outcomes during treatment. And those with that diffuse large B-cell lymphoma had significantly better outcomes receiving their chemotherapy treatment when they were supplemented with vitamin D. So it's critical for these patients to get adequate vitamin D for their bone health, but it's also important to remember that it's not just vitamin D alone that contributes to bone health. So it's very important to also get our vitamin K with with vitamin D, and then also calcium, because we know that calcium is contributing to the bone health, and magnesium also contributes to bone health. So it's, even though these studies are focusing on vitamin D, yes, vitamin D is very important. We also need these other three nutrients as well in order to make sure our bones are healthy. Anyone else that's also receiving some type of biphosphate therapy can also benefit from vitamin D supplementation and making sure that they have adequate calcium levels. And these kinds of therapies are things that help with the bones. So vitamin D and vitamin K, calcium, and magnesium, as I said, are all very important for bone health. Now, we can get them in different ways, though. I do like to get vitamin D from supplements because there's just simply not enough adequate sources in the diet. So salmon and trout, eggs, and some types of mushrooms can contain vitamin D. However, it's not going to get you that 1,000 IUs a day. That would really be the minimum recommended for most patients undergoing these situations. So that's why I typically recommend supplements. However, we can get things in adequate amounts from vitamin K, magnesium, and calcium. Calcium in particular is going to be a lot of our dairy sources, so yogurt, cheese, cottage cheese, even our non-dairy fortified options like even an almond-based milk or an almond milk will be fortified with good amount of calcium. We can also get it from our leafy greens like kale and spinach, but this is going to be harder to get from the leafy greens because it binds to other compounds called oxalates, which kind of traps the calcium. A way to get more of the calcium out of those leafy greens is to cook them or steam them. It loosens that bond, and so you're more likely to get more calcium in that way from those leafy greens. For vitamin K, we also see that the leafy greens are a rich source of vitamin K, so more reason to get our kale, our spinach, and leafy greens. Broccoli, Brussels sprouts, the cruciferous vegetables are really high in vitamin K. Other things like eggs and cheese are also high in vitamin K. Vitamin K is really helpful to get with vitamin D because it helps guide the vitamin D to the bones, and it helps guide the calcium to the bones as well. So we need our vitamin K. And then magnesium, I love nuts and seeds as a source of magnesium. So get your pumpkin seeds in, chia seeds, almonds. Can also be found in some of our leafy greens and our beans and legumes. So all of these foods contributing to bone health are really good for all of our blood cancer patients to get in, and then anyone on biophosphate therapy or anyone receiving chronic steroid use. Just to dive in a little bit more on the vitamin D. So studies suggest that vitamin D deficiency is associated with poor prognosis, higher rates of relapse, significantly longer hospital stays, and decreased rate of remission in patients with a lot of hematologic malignancies, such as that Hodgkin lymphoma, non-Hodgkin lymphoma, our multiple myeloma, leukemia, the myelodysplastic syndrome. So in all of these things, the studies have found that vitamin D deficiency is associated with those poor outcomes. So that's pretty significant. We want to make sure our patients are getting enough vitamin D. It's not always, the top of our focus because there's so many other things that we're focusing on with health. So that's where the dietitian and nutrition team comes in to help remind you about your vitamin D levels. So the first step is really, let's make sure that you have adequate vitamin D levels, because if not, we'll have to supplement you with a lot more vitamin D. If your levels are adequate, then we could do kind of a routine supplement of vitamin D, such as 1,000 to 2,000 IUs a day. Again, you could need more depending on what your current levels are. And everyone's different. So of course, we'll look to the doctor to get the blood levels and then help us guide on the recommendations. But typically this is what would be needed. I have some vitamin D examples listed on the screen. It does not have to be these specific examples, but these are just ways to help you find a vitamin D supplement. Typically, I look for a D3 because that's the active form of vitamin D versus a D2. And then I like these sources on the screen because these are all third-party verified or third-party tested, which means that it's gone through a lot more rigorous testing to make sure it's a high-quality supplement. Vitamin D supplements are also usually pretty affordable. Should be able to get them for about a $10 a month kind of supply. So again, not only for our blood cancer patients, which clearly show vitamin D deficiency, is we want to prevent that, but we also want to give this kind of therapy to anyone that's on biophosphates, or anyone that's on chronic steroid use, because again, they're going to benefit from this in their bone health. Transitioning to our other nutrients of focus are nutrients that are going to help with anemias. So lots of people undergoing any type of chemotherapy are going to experience some degree of anemia, but especially our blood cancer patients. And this is because the chemo is going to be suppressing our bone marrow, which reduces our red blood cell production. So not only does chemo damage the red blood cells, but it can also lower something in our blood called the EPO, or erythropoietin, and that is a hormone that actually is a precursor to produce red blood cells. So not only are we destroying the red blood cells, but we're making it harder to produce them with the chemotherapy. So on top of that, all patients might not even be getting proper nutrients to support red blood cell production based on poor appetite or side effects. So it really creates the recipe for anemia. And it's something that we just have to focus on with the medical team and then the dietitians to make sure we're getting enough nutrients to support red blood cell production, but that also we have supportive therapies needed from if the doctor suggests something like an EPO supplement or Procrit, or sometimes you might even need a transfusion depending on the degree or what's going on. But the nutrients of focus here are going to be iron, folate, and B12. They all contribute to the process of creating the red blood cells. Even if you're getting those supportive therapies, but you don't have enough of those nutrients, you're not going to be able to produce as many red blood cells as possible. So that's what I suggest to people. Now, if you're anemic during treatment, depending on the cause of the anemia, this can be why your doctor might prescribe different things. So sometimes they might even recommend an iron transfusion. Sometimes it might just be oral iron to help support hemoglobin production. Doctors might even prescribe a folate and B12 supplements during your treatment. Sometimes we even get B12 shots. So it just it's very individualistic, but just know that it's something that we need those nutrients to help with that type of therapy, to maintain that red blood cell production. So going back here, the iron is going to help with producing more red blood cells that they need to adequately form the hemoglobin. The folate is for the formation of the blood cells, for proper cell division and maturation in the bone marrow, and the B12 is similar role to the folate, where it's helping with the maturation of the red blood cells and facilitating that cell division. Platelets is another thing that patients will sometimes be low in their platelets, and vitamin B12, folate, and iron are really crucial nutrients to support the platelet production, and by aiding in that red blood cell in the blood cell formation. So B12 plays really a vital role in supporting that red blood cell production and platelets, again by supporting that DNA synthesis in the bone marrow, where the cells are being produced. Folate is also doing a similar role to the B12 that has to do with the formation of the cells and the division of the cells. And then iron, again, is necessary for that hemoglobin production. And so those are nutrients that we need to focus on also for the platelets. So both for platelets and for the red blood cells. And folate sources are going to be things like our leafy greens, our legumes, fortified grains, avocados. Folate is something that we really can get from the diet, or we could be supplementing if the doctor recommends it as well. Iron sources, of course, are things like our animal products, so meat, poultry, but I also tell people that you don't have to eat red meat to just eat red meat to get iron. You can also get it from things like the poultry, the fish. We can get it from fortified grains. So breakfast cereal, believe it or not, things like, like a healthier breakfast cereal, like a Total or Cheerios are going to have a lot of iron in them. They're fortified with a lot of iron. And then, of course, our legumes, tofu, leafy greens, nuts, and seeds all have iron as well. When you're eating the plant-based sources of iron, make sure that you're getting enough vitamin C, because this is going to help enhance absorption. So vitamin C is really high in things like citrus fruits, peppers, tomatoes, things like that. And then B12. B12 is in any animal product. So if you're not a vegan, you're likely getting enough B12. Although if you're on any acid reducing medication like proton pump inhibitors, especially, you might actually require a B12 supplement because you don't have enough acid in the stomach to absorb the B12. So it's important that if you have low platelets or have low red blood cells, contact your dietitian. We can help guide you on the nutrients that you might need to help support production of those things. So to kind of conclude here, food safety when immune compromised is very important. Basics are washing hands, avoiding cross-contamination, cook and store your food properly, avoid high-risk foods. So these are really the take-homes from that. Nutrients to focus for bone health. We want to focus on vitamin D levels and supplement accordingly based on our levels. We want to focus on other bone health nutrients too, such as vitamin K, calcium, magnesium. And then we also want to focus on nutrients for anemia in our platelets, such as our B12, our folate, our iron. Ask your doctor if it's necessary to supplement and see if you can get them through sources like food. So that's our conversation on nutrition for blood cancer support, nutrition support, and I'm happy to take any questions. We also have a cooking demo coming up in the second week of October, so October 8th. It's going to be cooking with cruciferous vegetables. So again, those vegetables that are going to be high in things like our vitamin K, our calcium, the folates, those are great. And then we also have the next nutrition lecture is focused on breast cancer. So, and Breast Cancer Awareness Month is in October. So those are our next upcoming things. And yeah, if you guys have any questions, I'm happy to address those at this time.
Yeah, I don't, has anybody put questions into the chat box or the Q&A?
I
I
don't.
don't see any questions. Yeah, I think that I'm going to tell everybody because that was, as I said at the beginning, education is for all of us. I know, Katie, that you had the running thread of blood cancers, but literally all this information is for all of us. And so I want everyone on this presentation to know that this has been recorded. So if you do want to go back and look at it, or if you want to share it with anyone that you know that would benefit from this information, uh, probably by next week when Well, Lee will send out the evaluation, but probably by next week, this will be edited and ready for her to send you a link that you can watch it again or share. And when she sends the evaluation, we appreciate you filling that out. And if you have any suggestions for other things that you would like to learn along the lines of nutrition, please add that in. It looks like that, Katie, you got not a question, but a nice comment. Can you see that?
Yes, yes. Thank you so much. I'm glad it was a helpful information for
Yeah,
me.
it was amazing information. I was taking a lot of notes myself. And so again, this is recorded, so if you'd like to see it, and as Katie mentioned, October is National Breast Cancer Awareness Month, and we have very active programs here at the Lynn Cancer Institute. And our next lecture, our physician panel lecture, will be on a Wednesday this year, Wednesday, October 16th. And again, this is going to be full of so much information. Our speakers, our physician speakers are going to be Dr. Louise Morell, Juliet Tay, Carrie Ann McDonald, Hillary Shapiro Wright, Ivo Pastana, Yosef Zaiden, Angelina Tay, and Teresa DeCesar. So please request a flyer from us if you've not gotten one, because just like on this lecture, you can click right on the link to register. And then on Saturday, October 19th, we're going to host our annual, since before COVID, we weren't able to hold it live, but we're bringing it back, our what we call our breast cancer bazaar. And this also is a morning of education. We're going to have breakout speakers. We're going to have free skin cancer screenings and lots of shopping. So we'd really love it if you'd like to start your holiday shopping with us. And then Wednesday, October 30th, Brandy, our dietitian, will be presenting in our nutrition series. The topic is what is best for breast cancer, exercise and nutrition from prevention through survivorship. And I'll just add, one way or the other, we're all survivors. So no matter what we're a survivor of, we need this great nutrition education. So we appreciate all of you joining us today. And thank you, Katie, for all that amazing research and presentation. And okay, let me get the name really quick before we sign off, that wants to get the information on the 16th. Yes, we're very blessed with not only our staff members that are so well educated, but they're willing to take time out of their busy schedules to share it with all of us. So Katie, thank you. And thank you everyone for joining us.
Thank
Oh, you got another nice kudo. Great
you.
lecture.
Thank
Yeah,
you.
I think we'll all agree this was really great.
Thank you.
Okay, thanks, Katie.
Bye.
Bye-bye.